we're able to carry out that critical task. We do not have an interest in doing anything other than that. And we've tried to set up a system that is as fail-safe as, so far at least, we've been able to think of, to make sure that these programs are not abused. But people may have better ideas. And people may want to jigger slightly sort of the balance between the information that we can get versus the incremental encroachments on privacy that, if haven't already taken place, might take place in a future administration or as technologies develop further. And the other thing that's happening is that as technology develops further, technology itself may provide us some additional safeguards. So, for example, if people don't have confidence that the law, the checks and balances of the court and Congress are sufficient to give us confidence that government's not snooping, well, maybe we can embed technologies in there that prevent the snooping regardless of what government wants to do. I mean, there may be some technological fixes that provide another layer of assurance. And so those are the kinds of things that I'm looking forward to having a conversation about.
Can you understand why people might not trust what you're saying right now about wanting them to have confidence in the reforms that you're
No, I can't. Well, the fact that I said that the programs are operating in a way that prevents abuse, that continues to be true without the reforms. The question is, how do I make the American people more comfortable? All right? If I tell Michelle that I did the dishes, now, granted, in the White House I don't do the dishes that much, but back in the day, and she's a little skeptical. Well, I'd like her to trust me, but maybe I need to bring her back and show her the dishes, and not just have her take my word for it. And so, you know, the program is, I am comfortable that the program currently is not being abused. I'm comfortable that if the American people examined exactly what was taking place, how it was being used, what the safeguards were, that they would say, you know what, these folks are following the law and doing what they say they're doing. But it is absolutely true that with the expansion of technology, this is an area that's moving very quickly. With the revelations that have depleted public trust, that if there's some additional things that we can do to build that trust back up, then we should do them. Jonathan Karl.
Thank you, Mr. President. You have said that core al-Qaeda has been decimated, that its leaders are on the run. Yep. Now that we've seen this terror threat that has resulted in embassies closed throughout the Arab world, much of Africa, right, do you still believe that al-Qaeda has been decimated? And if I can ask, in the interest of transparency, can you tell us about these drone strikes that we've seen over the last couple of weeks in Yemen?
What I said in the same National Defense University speech back in May that I referred to earlier is that core al-Qaeda is on its heels, has been decimated. But what I also said was that al-Qaeda and other extremists have metastasized into regional groups that can pose significant dangers. And I'd refer you back to that speech just back in May, where I said specifically that although they are less likely to be able to carry out spectacular homeland attacks like 9/11, they have the capacity to go after our embassies. They have the capacity potentially to go after our businesses. They have the capacity to be destabilizing and disruptive in countries where the security apparatus is weak. And that's exactly what we are seeing right now. So it's entirely consistent to say that this tightly organized and relatively centralized Al-Qaeda that attacked us on 9/11 has been broken apart and is very weak and does not have a lot of operational capacity. And to say we still have these regional organizations like AQAP that can pose a threat, that can drive potentially a truck bomb into an embassy wall and can kill some people. And so that requires us then to make sure that we have a strategy that is strengthening those partners so that they've got their own capacity to deal with what are potentially manageable regional threats if these countries are a little bit stronger and have more effective CT and so forth. It means that we've got to continue to be vigilant and go after known terrorists who are potentially carrying out plots or are going to strengthen their capacity over time, because they're always testing the boundaries of, well, maybe we can try this, maybe we can do that. So this is an ongoing process. We are not going to completely eliminate terrorism. What we can do is to weaken it and to strengthen our partnerships in such a way that it does not pose the kind of horrible threat that we saw on 9/11. And I'm not going to discuss specific operations that have taken place. Again, in my speech in May, I was very specific about how we make these determinations about potential lethal strikes. So I would refer you to that speech.
So you won't even confirm that we carried out drone strikes in the end?
I will not have a discussion about operational issues. Ed Henry.
I hope you would defend me as well.
I would.
Okay, thank you. I want to ask you about two important dates that are coming up. October 1st, you got to implement your signature health care law. You recently decided on your own to delay a key part of that. And I wonder, if you pick and choose what parts of the law to implement, couldn't your successor down the road pick and choose whether they'll implement your law and keep it in place? And on September 11th, we'll have the first anniversary of Benghazi. And you said on September 12th, make no mistake, we'll bring to justice the killers who attacked our people.
Yeah.
11 months later, where are they, sir?
Well, I also said that we'd get bin Laden, and I didn't get him in 11 months. We have informed, I think, the public that there's a sealed indictment. It's sealed for a reason. But we are intent on capturing those who carried out this attack. And we're going to stay on it until we get them.
And you're close to having suspects in custody?
I will leave it at that. But this remains a top priority for us. Anybody who attacks Americans, anybody who kills, tragically, 4 Americans who were serving us in a very dangerous place, we're going to do everything we can to get those who carried out those attacks. With respect to health care, I didn't simply choose to delay this on my own. This was in consultation with businesses all across the country, many of whom are supportive of the Affordable Care Act, many of whom, by the way, are already providing health insurance to their employees, but were concerned about the operational details of changing their HR operations if they've got a lot of employees, which could be costly for them, and them suggesting that there may be easier ways to do this. Now, what's true, Ed, is that in a normal political environment, it would have been easier for me to simply call up the speaker and say, you know what, this is a tweak that doesn't go to the essence of the law. It has to do with, for example, are we able to simplify the attestation of employers as to whether they're already providing health insurance or not. It looks like there may be some better ways to do this. Let's make a technical change to the law. That would be the normal thing that I would prefer to do. But we're not in a normal atmosphere around here when it comes to quote-unquote Obamacare. We did have the executive authority to do so, and we did so. But this doesn't go to the core of implementation. Let me tell you what is the core of implementation that's already taken place. As we speak, right now, for the 85% of Americans who already have health insurance, they are benefiting from being able to keep their kid on their plan if their kid is 26 or younger. That's benefiting millions of young people around the country, which is why lack of insurance among young people has actually gone down. That's in large part attributable to the steps that we've taken. You've got millions of people who've received rebates because part of the Affordable Care Act was to say that if insurance company isn't spending 80% of your premium on your health care, you get some money back. And lo and behold, people have been getting their money back. It means that folks who've been bumping up with lifetime limits on their insurance, that leaves them vulnerable. That doesn't exist. Seniors have been getting discounts on their prescription drugs. That's happening right now. Free preventive care, mammograms, contraception. That's happening right now. I met a young man today on a bill signing I was doing with the student loan bill who came up to me and said, thank you. He couldn't have been more than 25, 26 years old. Thank you. I have cancer. Thanks to the Affordable Care Act, working with the California program, I was able to get health care, and I'm now in remission. And so right now, people are already benefiting. Now, what happens on October 1st in 53 days is for the remaining 15% of the population that doesn't have health insurance, they're going to be able to go on a website or call up a call center and sign up for affordable, quality health insurance at a significantly cheaper rate than what they can get right now on the individual market. And if even with lower premiums they still can't afford it, we're going to be able to provide them with a tax credit to help them buy it. And between October 1st into March, there will be an open enrollment period in which millions of Americans, for the first time, are going to be able to get affordable health care. Now, I think the really interesting question is why it is that my friends in the other party have made the idea of preventing these people from getting health care their holy grail, their number one priority, the one unifying principle in the Republican Party at the moment is making sure that 30 million people don't have health care. And presumably repealing all those benefits I just mentioned, kids staying on their parents' plan, seniors getting discounts on their prescription drugs, I guess a return to lifetime limits on insurance, people with pre-existing conditions continuing to be blocked from being able to get health insurance. That's hard to understand as an agenda that is going to strengthen our middle class. At least they used to say, well, we're going to replace it with something better. There's not even a pretense now that they're going to replace it with something better. The notion is simply that those 30 million people, or the 150 million who are benefiting from the other aspects of affordable care, will be better off without it. That's their assertion. Not backed by fact, not backed by any evidence. It's just become an ideological fixation. Well, I tell you what, they're wrong about that. There is no doubt that in implementing the Affordable Care Act, a program of this significance, there are going to be some glitches. No doubt about it. There are going to be things where we say, you know what, we should have thought of that earlier, or this would work a little bit better, or this needs an adjustment. That was true of Social Security, that was true of Medicare, that was true of the Children's Health Insurance Program, that was true of the Prescription Drug Program Part D that was rolled out by a Republican president and supported by Republicans who are still in the House of Representatives. That's true, by the way, of a car company rolling out a new car. It's true of Apple rolling out the new iPad. So, you will be able to, whenever you want, during the course of the next 6 months and probably the next year, find occasions where you say, aha, you know what, that